And remember, your health matters is brought to you with the kind compliments of People's Pharmacy. And now it's time for our program. Your health matters with Dr. Jerol Thompson. Doc, you ready to go?
I'm ready to go.
All
You
right, well, let's go.
okay? All right, Martin. Thank you very much for the intro. There, I suppose I didn't have my microphone off. A very, very pleasant good evening. I wasn't really listening for the intro. Ladies and gentlemen, this is Your Health Matters. I know some persons are sitting back and relaxing and just listening to what the topic is today. Recently, I've got a couple of emails and WhatsApp that persons have been telling me that they feel depressed. They are in some form of depression. The first time I got a couple of persons was about 2 months ago. And then another month ago, a few persons, I went to see somebody about a month and a half ago, and they were feeling really down, you know? Now, what is depression? It's normal to feel down once in a while. But if you're sad most of the time and it affects your daily life, you hear that? It affects your daily life. You may have what we call clinical depression. Now, it's a condition that can be treated with medicine. It's a condition that can be treated talking to some sort of therapist or somebody who has knowledge of depression. And it can also be treated by making some changes in your life. Let me say clearly, if you're in a relationship, Marlon, and the relationship is not going well, suppose you're being abused, or suppose the person you think doesn't love you anymore and may love somebody else, these are not uncommon situations. And it can be recommended that change in your lifestyle can help. If on a job you're feeling really like crap, a change in your job, if you can, may help. But certainly, when it comes to treatment with medicine or going to see a therapist, sometimes a therapist could cost money. Those options are things you need to think about a little bit more. Now, there are many types of depression. There's some of the more common ones, and there's some that are very strange. And events in your life can cause some of these things. A death, let's say, of a brother, sister, of your grandmother. And also chemical changes in your brain can also cause depression. Whatever the cause, your first step is to see a doctor, a physician who may be a psychologist, a psychiatrist, or a general doctor, and to let them know how you're feeling, for them to assess the situation. They may then refer you to a mental health specialist to help figure out what type of depression this is, or the type of depression you may have. Because there are different types of depression. And this diagnosis is important in deciding the right way to handle you and treat you. Simple like that. The big step is getting up and going to see somebody, a doctor, and trying to find out what's going on. Remember, it's normal to feel down once in a while. But if you're sad most of the time, that's not good. And now, there are some common types of depression. Let me go through some of the important ones. The big one is what we call a major depressive disorder, an MDD, major depressive disorder, right? We should call this endogenous depression, major depression. It causes intense sadness, a loss of interest in things, a loss of interest in going out, a loss of interest in having people around you, a loss of interest in, if you were a cook, a loss of interest in cooking. If you were a cleaner, you're a person who was a stickler for order, well, you start forgetting about that sort of thing. It affects your daily life. And once you start having a depression that affects you for more than 2 weeks, we consider it as a major depression. In other words, Marlon, if you have a depression that lasts for a couple of days, that's all right. A depression that lasts for a week, that's all right. But once it goes past 2 weeks, if a depression is going for a month, that's not good. Now, let me give you another one. Persistent depressive disorder. This is not something for 2 weeks or a month. This is chronic, long-term. A person with low mood, you go check them out, the mood is low. You go check them out 2 months later, the mood is low. It is less severe than a major depression, but can last for years. Persistent depressive disorder can last for years. And then there's something we call seasonal affective disorder. We call it SAD. Seasonal, that's S, affective disorder. And we use an abbreviation called SAD. Yes, that person is sad, but it's linked to seasonal changes. Boy, this happens to a lot of people up north. Winter comes by, and they just get sad because it's winter. We call winter blues, right? It is less severe than a major depression as well, but it starts in fall or winter. And guess what? When the spring comes by, you're okay again. The person's okay. It's a seasonal affective disorder or SAD. Now, there's another bad one called bipolar disorder. This is where there's extreme mood swings. Somebody could be intensively anxious, anxiety, and hyper. And then a couple of weeks later, or a couple of days later, they swing. The pendulum swings. They get low. Major depression again. And then it swings again. They get manic and hyper. Right? And a hypermanic, the highs, you get highs and you get lows. Highs and low, we call it bipolar. The poles being a high pole and a low pole. Depression and a high. Anxious, manic, that's M-A-N-I-C, manic, and that's not nice. These disorders are terrible. I've seen people with bipolar disorders, they take chairs and tables and throw it out the window. They throw their clothes out the window. They smash up the television. And a couple of days later, they're gone low. They're in bed, they're in a chair, sunken in a chair. You can't get them out of the chair. And later on, they get up again, start to smash other things. It's bipolar disorder. Then we get into a very unusual type of disorder called postpartum depression or perinatal depression. Clearly, this occurs often during pregnancy in some women or just after childbirth, and it is linked to the way the hormones of pregnancy shifts, right? And how that affects the prospects of a new parental demand. So a baby's born and the mother doesn't even want to touch the baby. She just wants to breastfeed. She just wants to care for the baby, right? She's indifferent. She has postpartum perinatal depression. Boy, that is not nice either. And then there's another one, I got to see this in women. It's called premenstrual disorder or premenstrual dysphoric disorder. Severe symptoms of mood swings, irritability, depression, starting a week before period. We used to call this PMS. Marla, have you heard of that before? Yep. Have you heard of PMS?
Definitely.
Well, they've coined that disorder, PMS. They don't want to call it PMS anymore. They want to call it premenstrual dysphoric disorder, dysphoric disorder, or for short, PMDD. All these DDs and PM, that's that PM, I should say PM, PMDD, it has nothing to do with Prime Minister and all that other stuff, It's PMDD, is premenstrual dysphoric disorder. Boy, this is common. This is common. I have been associated with some women who have this disorder. PMS, which is an older term used to call, please move to another state. Now, I'm going to be criticized for laughing down at this, but boy, it is a real disorder. And I have suffered as a result of this in relationships, I tell you. And it takes an art, it takes an understanding to really get over that. That 1 week before the menstrual cycle, the changes in the hormone levels, the way it affects the brain, it causes mood swings, irritability, depression, and anything can trigger it off. As a male, during that week, you have to be on your toes. You have to be on your P's and Q's, or you could trigger World War II, World War III, and more. Now, there's what we call psychotic depression. This is another major depression, right? But this time, the person is having hallucinations. They're having delusions. Their thinking is going off. Delusions. So it's a serious illness. So all these forms of depression, they are treated in different ways. They're handled in different ways. And, depression could also be considered to the degree as being mild, moderate, or severe, and can include other things like, a whole set of other things. It could even be treatment resistant. People have gone and had treatments and seen therapists and so on. They conclude that the depression is just so severe that nothing could be done. That isn't true. So let's start. Major depression. You may hear a doctor call this clinical depression. You might have this type if you feel really depressed most of the time, for most days, for weeks on end. And it is the most severe form of depression. And when people get into it, you need to give them help. It isn't a situation where you tell them, man, get up, man, man, behave yourself, get up and do something, man. What kind of nonsense you're getting? That isn't going to work. There are chemicals that are being produced in the brain that essentially make the brain work. And when some of these chemicals are low, when some other chemicals are too high, they can cause depression. You know, the major symptom is that there's just loss of interest or pleasure in the usual activities. The person who used to love dancing ain't want to dance soca anymore. You know, even a person who used to want to go to church and wear the nice hat going to church, they don't want to do that anymore. You know, the person who used to cook and get up in the morning and cook lunch and cook dinner and love that, they don't want to do that anymore. They don't want to clean the house and so forth. You know. They usually have, but they could also have weight gain by just sitting down and doing nothing. You know, they can be eating often less than normal, but sometimes they can eat more. They feel sleepy virtually all the time. And at the same time, they have trouble falling asleep. So they'll be up at night trying to go to sleep, can't go to sleep. Their depression is causing that. But during the day, they're sleepy, wanting to go to sleep, always drowsy. They feel restless and agitated when they're alert. And they're very sluggish. And they seem mentally much slower than what they used to be. They're not as sharp in their responses. They seem to be tired without the energy to do things. And they start expressing feeling worthless, about feeling guilty about something they won't necessarily talk about. They feel down, you know, and they have a lot of trouble concentrating. Now, a lot of people may say, but I feel that way. I've felt that way at some point in time. But as I said, you could feel that way for a day. You could feel that way for 2 or 3 days. But when you start feeling that way for 2 weeks and more, that is major depression. Major depression becomes a problem when some persons start to have thoughts of suicide, or thinking of attempting suicide, or of hurting themselves, like a plan to end their life. They're going to throw themselves off a cliff, throw themselves in front of a car. They're going to take some tablets, you know? They're going to do something to hurt themselves. You know, it's important that these people get the right treatment. You all may know of somebody who's been through this sort of thing. And very often we ignore these persons because some teachers say, man, the person should buck up. Marla, you ever known anybody in that sort of situation? Yeah? Mm-hmm. It's tough. It's tough. Matter of fact, once I asked somebody, have you ever known somebody in that same situation? They said, boy, that's the way I feel. They're saying they feel the same way too. You know, so one of the hallmark of making a diagnosis is that the person been feeling that way 2 weeks or longer. And they must have at least one symptom of a depressed mood, feeling down, feeling no energy, loss of interest, and so forth. Once this has been going on for 2 weeks, and that situation, this may be a major depression. It's different from people. And, you know, it's really important that you recognize this and you treat the person by encouraging them to go and seek treatment. Now, we used to use a term called melancholy. Melancholy, we don't use that much anymore. This is somebody who feels intensely sad and they lose interest in activities that we know they used to enjoy. And, you know, they even feel bad when good things happen to them. You try to get a smile on their face, get them they might put on a plastic smile, but then they're gone right back. Nothing is inspiring them. Nothing is picking them up. You know, they feel extremely hopeless, sad, especially in the morning. And not only do they lose weight because they have no appetite, they sleep poorly, and these people also have suicidal thoughts. You know, we have to worry about these type of people. And it's important that therapy, there's some good psychologists around, good psychotherapists, and they can help by getting to the bottom of these things. Remember, some of these things are because of chemical imbalance, but usually there's some also, what compounds it, there's some events that take place in their life. It's more than if their husband is cheating on them or if their wife is cheating on them. It's more than if they've lost a job. It's more than if their cricket team hasn't won. You know what I mean? It's more than that. And it's a combination of these things. Now, medication called antidepressants can be useful here. And treating depression, right, with both talking to a therapist and medication is probably one of the best ways, because the talking could help steer the person in the right direction. And the medication, rather than using medication alone, using high doses, using smaller doses along with the talking. And boy, this really works. You know, today, but more so long ago, they used to do electroconvulsive therapy. They used to take some electric probes and put it against somebody's temples, scalp, and send an electric current through it. That's supposed to pass through your brain. Electric shock passes through your brain, and that's supposed to get you out of it, get you out of the mood. Sometimes it worked, sometimes it didn't. You know, there's all sorts of things that work. There are nerves that can be stimulated. Now, I don't want to talk a lot about these types of treatment because they're used when things are very severe, people who are really chronic. But when somebody has what's called a persistent depressive disorder, I'm talking about long-term disorders going on for 2 years and longer. Imagine somebody depressed for 2 years. I'm not talking about more than 2 weeks, you know. That's a major depression. I'm talking 2 years. It's called a persistent depressive disorder, PDD. And these persons usually end up in a hospital for a longer period of time. You know, it's a chronic major depression. Somebody who's been resistant to treatment, it requires a lot of intensive work of talking and some powerful medication. And boy, I mentioned to you about this bipolar disorder where somebody gets very anxious, high, and then they get depressed and they just go back and forth. They could be normal in between. And then these things. Usually medication is what works here. Medication is what works with this type of, and there's some very important medications that are now out on the market for bipolar disorder. You know, the thing is, doctors sometimes prescribe other drugs. There are lots of what we call off-label drugs. Drugs that have not been proven to work, but they have worked at the recommendation of some other specialists. But there hasn't been what we call the trials. There hasn't been to see if they work with everybody. But sometimes when people are very depressed and what you've been using doesn't work and the person is even thinking suicide and thinking of harming themselves or have tried harming themselves many times and you're worried about the next time they will be successful, then, you know, you have to try some of these off-label medications. these medications that haven't been proven to work, but you have to try them anyway. You know? Now, there's really a lot of trend. Now, I want to go back to what I mentioned about seasonal affective disorder. And we touched this one before we go on the break, but seasonal affective disorder called SAD, is a type of depression that comes with the seasons, usually winter. We don't tend to see that much in St. Vincent, but our relatives who live in England, Canada, the United States may tend to see some of this. It doesn't mean that if they're from Canada, United States, and England, that they will suffer from this. No, it is something that is quite common. You're more likely to have this disorder if you live further away from the equator, such as Alaska, New England, and Canada, as I said. Now, these things are again hormonal, and there's certain hormones that are in your brain and so that seem to shift with the weather, the sleep-wake cycle, the moon, I would say. And problems with these hormones are thought to cause this condition called SAD, seasonal affective disorder. And as I said, it causes these hormones, something called serotonin, something called melatonin, to go up and down. And these changes cause these conditions, especially for some of our relatives. Let's take a break, and I'll come back and I want to get into some of these other things.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Your health matters.
How much do you know about what makes up a healthy lifestyle?
Your health matters.
How do you define good nutrition?
Join Dr. Jerol Thompson, physician, specialist, and notable environmental conservationist, every Wednesday, 8 to 9 p.m. here on WeFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here on WeFM 99.9 because your health matters.
Yes, and remember, you can call at any time, 457-9997, WhatsApp or straight. Love to take your call, or you could give us a WhatsApp text. We'll read the text and try and answer your question. Now, I brought up this issue of depression, not so much to look at major depression or chronic depression over 2 years, or the seasonal depression, as I've mentioned to you. Those three conditions are real. But I want to touch on two topics that I've brought up. One called prenatal depression, or as a result of pregnancy. Now, prenatal depression happens during pregnancy or just after the baby is born. Usually we start seeing it before the baby is born, before birth, and causes ongoing and extreme sadness even after this joyful event. What's supposed to be a joyful event of having a baby occurs. Mom is very sad. And Again, a big part of that is your hormone levels have changed during pregnancy. When the baby comes out, these hormonal, even before the baby comes out, these hormonal levels have been changing. And definitely they change abruptly after the child is born and the baby comes out of your system. These changes can affect your mood, the mood of a woman, leading to depression symptoms that can last longer than a few days. And when it does occur, whether it lasts for a few days, a few weeks, a few months, treatment is often needed to improve the symptoms. Now, what are the usual symptoms of this? And women who've had children, you could link into this. You may have had a friend who've gone through these things. The condition that most women have is that, first of all, let me say, it occurs mainly in women who may have had a history of some sort of mental illness before. So if they were depressed before, or if they had a nervous breakdown before, they are at greater risk of this prenatal depression before and after having a baby. They are usually women who are also dealing with a very stressful event on top of the pregnancy. So you have the pregnancy, but there's something else going on. Is their husband cheating on them because they're pregnant? You know, did they lose their grandmother or grandfather? As a result of pregnancy, have they lost a job because they can't work anymore, but they need the money? And they were working right up until the end of the 9 months, and they needed the money, you know? And they've had to stop. These extra stressful events on top of the pregnancy can be triggers. Also, if they have an unsupportive partner, no partner, or in general, they lack support from family members, they have an expected, an unplanned pregnancy. In other words, there's some women who they only find out that they're pregnant sometime after 4 months. They didn't know that they were pregnant. This sometimes happens in women who might be overweight, very obese. They sometimes don't know they're pregnant because they often miss the period anyway, you know? And they find out later. And I have found young girls who complain, I've got this stomach pain all the time and I'm putting on a little weight. And when you check, they're 5 months pregnant. They didn't know. You know what I mean? You might say, that's impossible. It is so common. They're carrying a child also with a health problem. You know, in other words, and I got to say this, sometimes a mother, because of tests that are done, may know that the child is not going to come out normal. The child, they do tests and they could pick up that. This is true when you have a family history of some disorder. And the doctor in some countries will say, let's do a test to see if the child has this before the child is born. And when they do the test, and you wonder how they do the test, they actually go in and they can take fluid from the fetal sac. It's called amniocentesis. Yeah, they stick a needle in and can draw fluid out and do tests on it whilst the baby is still in the mother's womb. And they can run tests on it. And they can tell the mother, your child has a 90% chance of being born with this disorder, that disorder, or so. And the mother may because of certain religious belief, may say, well, I'm going through with it. But these are also some of the mothers who may be at risk of prenatal depression. You know? Do you know that women who have twins and triplets tend to go through more depression than women who have a single birth? Yes. If a woman is having twins and a woman is having triplets, bring a therapist in to talk to them, to help them through it. Everybody should know there's a higher risk. And then if they've had trouble getting pregnant for many years, they're in their 40s and they've been trying to get pregnant for many years, they're also at risk of going through depression. Finally, they're pregnant. Finally. But they're worried. They're worried they might lose the pregnancy. They're worried something might happen. They're worried so much they get depressed as a result. And again, these patients, they have symptoms. They have loss of appetite, loss of interest, all these things with depression, irritability, feeling sad and hopelessness and all these sort of things. And they have a lot of physical symptoms. It is a serious thing. This is a similar sort of situation to postpartum depression. The mother who's postpartum depression are really similar. And about 1 in 7 mothers, they say, can experience some symptom like this. And your doctor may recommend counseling, support groups, some mild medication can really help you. Now, I want to end with this last disorder. Let me give us again 457-9997 or WhatsApp. Is there any? Yes. Premenstrual disorder, PMS. Premenstrual dysphoric disorder, PMDD, what we used to know as PMS. Now, people assign female at birth with this condition, PMDD or depression and other symptoms, that this occurs a week or sometimes up to 2 weeks before their period starts. This mood disorder is more severe they say, than the ordinary, what we know as premenstrual syndrome, PMS. And it interferes with daily life, but you usually start to feel better a few days after the period starts. Now, besides feeling depressed and overwhelmed, you're going to have mood swings, irritability, severe anxiety, trouble concentrating, fatigue, and a change in your appetite as well. Now, antidepressant, the medications that help cut depression can be used. And I want to say that a lot more women suffer from these type of condition, PMDD or PMS, than we think. And they go through life, and it is something that is very disruptive of a lot of their relationships. Some men are not able to understand what women are going through, that there are these mood swings as a result of hormonal imbalances just before the period starts. And it it leads to a lot of problems in relationships, in marriages, if this becomes a serious issue. Now, treatment of all these different types of depression, about 1/3 of people treated for depression will try several treatment methods without success. If that's you, you then might have treatment-resistant depression. There are many reasons your depression might be treatment-resistant. For example, you might have other conditions that make your depression difficult to treat. Now, if you're diagnosed, the big question is, how is it going to be treated? Well, once again, you have to go to the doctor. Now, let's take the call here. Hello, good evening. Yes, the person, you turn on your radio. Hello, good evening.
Good evening, Dr. Thompson. How are you doing?
Not too bad at all.
Yes. As I talking about depression, you're a doctor, qualified, trained in so many different things. But I as someone coming from the masses, so to speak, the question I want to ask you, because I believe with the multiplicity of problems coming in all different areas in any particular country, but St. Vincent and the Grenadines right now in particular. I think that the multiplicity of domestic problems, etc., a lack of employment, and even in your poverty strictness. I want to believe in the year 2025, with all what is happening, it is causing a lot of depression, or that is one of the factors. In other words, you have more problems to deal with in 2025, and especially when it comes to economic situation and all of that. Because I must admit, maybe God bless me in a way that I can handle this. But when I interact, or when I used to interact, because I don't see much people now except I speak to them on the telephone, I realize some of the problems, domestic problems that they're confronted with or faced with. And I've come to the conclusion that, put it like this, if people are not happy, if things are bothering them, you see, I'm just saying it in layman's term, no sophistication in language and all of that. Although the doctor knows are doing certain, studies and so on, to come up with certain words that even can confuse people more. But I say all of that because I want to believe that if you are living in a situation, in an environment, in a country where where we can't cope, all because of our daily problems, we are bound to have depression. And I conclude by putting it that way. I don't know what you'll say to that if I speak nonsense or anything.
Yeah, let me come in here. I think let me say this in several parts. Do you know who go through eruptions, hurricanes and wars and are displaced. With a hurricane, we talk about how much people died in the hurricane. Let's say one person died or no person died. We say, oh God, nobody died in Hurricane Beryl. But just after Hurricane Beryl, we start to also count the number of persons who may die. Some people die because their blood pressures are up, they're smiling, but rarely they're going through some severe internal depression. They might even be smiling. The anxiety, the stress they're under. And a lot of people go into a lot of stress because their homes have been destroyed. Let me tell you that one of the big reasons why there was a rush to try and rebuild in communities and put back on roofs is that I remember when I went down to Louisiana after Hurricane Katrina, and I saw huge areas where Black people lived. For months and weeks, there was no rehabilitation. Many had left and gone to Houston. Some people repaired their house, but other people's house was so badly damaged they couldn't come back. The level of depression that existed in these communities is so severe. Now, I'm saying all this because depending on which part of the world you are and whatever events are taking, whether it is war in the Middle East, whether it is some racial thing in another country, a tribal war or bombing or suicide bombing in this place, or whether it's racism in southern here, southern there, in Sudan, civil war. I could go around the world and talk about problems that exist in different parts of the world. But if you are able to get people back on track, it helps by rebuilding their homes, putting a roof on, getting some semblance of life back. You can avoid a lot of depression. They might still be depressed for a period of time, but they tend to recover without treatment. And you're absolutely right that I have been to some parts of the world. When you start talking what people eat, I thank the Lord today. I picked a carambola off a tree, a ripe carambola, and ate it just like that. And then I picked 2 guava and a Dunes plum, and I ate them, and I felt good, Dave. And I felt so good that I could do that.
Right.
Could you imagine? Could you imagine if you couldn't get a mango? And you couldn't get, you have certain conditions. I should not recommend some of these things for you. Yes, sir? I should not recommend the mango for you at all. But imagine people who can't get food to eat. I'm not talking about us where you get jibby yam and you could get still some sweet potato and sweat some plantain and so forth and things like that. I'm not talking about that. I'm talking about in parts of the world where there's abject poverty and where there's no access to real food. I'm not making a comparison. I am saying you're absolutely right. People suffer from depression and from stress in the same way here in St. Vincent and the Grenadines, right? But
I just wanted to end by saying this.
Yeah.
You see, that's why I made the point. It's a good thing. God must bless me. I know the Christians only hear me speak like this.
yes.
But let me say this. These are the factors. These are some of these are the things I look at critically. And as I'm saying that, don't forget, I know for myself, I grew up enjoying fresh fruits and all that sort of thing in my time.
Yeah.
And then there came this invasion by cultural penetration or whatever penetration you want to call it, where we were forced, or maybe I shouldn't even say forced,
No,
but
it's
it
not a
had
word.
such an influence. It had such an influence for us to be attracted and became addicted to chemical food, if you understand what I'm talking about.
Ultra processed food. Yes, ultra processed food.
So that became a norm for us.
Yes.
So much so. Let me just give you like a quick example. I remember the days when I used to love when I traveled out throughout the country. You know something I took note of, especially on a Sunday. I used to love to smell the pots of different people cooking whatever they're cooking. That used to leave such a nice aroma with me. Now, I don't know if you can get that. Everybody gets hooked up with fast food.
Well, maybe you're spending too much time in town too. You know what I mean? Maybe you're spending you had as well as a new town, a new city, and so forth. But I want you haven't visited because of your inabilities and so forth. You haven't been down Chateaubriand. Well, you know what I mean? As a matter of fact, in Bayaboo. I mean, I tell you something. Even in Prospect, somebody was cooking a pot, and it smelled nice. It smelled nice. As a matter of fact, down at the mangrove, I haven't done it recently, but I've been thinking about some crab and cassava. You know, I mean, Marlon here is from East St. George. Marlon, one of these days, Dave can't come because you know he's tied up. But come down to the mangrove and get some crab and Kylaloo. Yes, sir.
I know when you tell you never found it possible, necessary to come on and invite me.
Let me say, Dave, I gotta wrap up. You made some important points. Let me conclude, Doctor. You know, the thing is that, you know, there isn't so much difference in terms of tongue and country. Yes, there's fast food and there's always going to be fast food, you know, and ultra processed food, that may be part of the problem and so forth, yes. But a developing nation doesn't necessarily mean 30, 40 years ago, Dave is saying that there was probably less depression because there was less stress and the pots were on fire and you could get nice, healthy food. But guess what? The country was quite depressed. There were the kind of jobs that they might be, you know, working on an estate for some cents, you know what I mean? And going back further in the colonial days and so forth, you know, I'm not sure how great we felt about ourselves with Massa and the estate owners and all them kind of things. I'm not sure if somebody would say those are better days. You know, I'm not sure about that. But for sure, depression is real. And whether you've got major depression, I've pointed out that there's some chemical issues that can be imbalanced that's superimposed upon life situation. There can be premenstrual tension, PMS, and those type of disorders. And there can be postpartum depression, and there can be seasonal depression. Ladies and gentlemen, depression is real, whatever the cause, however severe, and so. And I want to say that I am still glad that I am in St. Vincent. We don't have the ultimate best psychiatric services here, you know, but still, we have decent care. And if you do have depression, please seek treatment. Try and see how we can avoid this becoming chronic. This is Dr. Jerol Thompson bidding you a very good evening and good night. How much do you know about what makes up a healthy life?